that most women should be able to get a baseline mammogram at the age of 35. That can maybe help us include some of these ladies that are being seen with breast cancer under the age of 40. And as far as why the incidence is rising in certain ethnic groups, like Asian American and Pacific Islander, may be due in part to the fact that we're just seeing the incidence of breast cancer rise in most groups.
Well, let's dig a little deeper into that. You talk about getting a baseline mammogram before the age of 40, if possible. How can you do that? I mean, if your insurance doesn't cover it, what sort of resources or options are out there for people? I know for me personally, I do have a history of breast cancer in my family, and I tried to get a mammogram when I was 35 years old, and I was turned away. So, what can you do in that sort of situation?
So, one of the things that I think is important is understanding what your risk is, just like you said. So, knowing your family history and having a thorough risk evaluation at age 25 can help us identify if you are indeed at an elevated risk for breast cancer or if you would fall in the group of women who are average risk. Now, women who are at an elevated risk will be a candidate or available to start screening early. Now, if it's determined that you're at average risk, then 40 is going to be the most common time to start. If you're having any symptoms with your breast, like pain, you feel a lump or a mass, this is going to be a way that you would be able to start having an investigation into your breast, like an ultrasound or a mammogram, before the age of 40. Some insurances will cover for a woman to have a baseline mammogram at age 35, but maybe not all insurance carriers will.
And what
So it's a
makes,
matter of asking.
yeah, and what makes you have an elevated risk versus an average risk?
That's a great question. So, one of the biggest things is family history. And so, understanding who in your family's had breast cancer, how close that relative is to you. So, a first degree relative is going to be someone like a grandmother or your mother, sister, that type of thing. So, those family members are going to be significant impacts on your risk. And more importantly, is when did they develop breast cancer? So we know that breast cancer is most common in the later decades, 60s. But if there are people in your family that have developed breast cancer in their 40s, 30s, these are suspicious for things that are passed along in families, and this group of women are going to be at the highest risk for breast cancer.
Talk to me a little bit about the BRCA gene because we hear about that a lot. We hear about celebrities, especially getting tested to see if they have the gene. What exactly is that? And should you get tested for it? And how does that even work?
A great question. So the BRCA gene is one of several things that we can find in our DNA. It's normally there, but some people that gene doesn't work properly, so it makes them at a higher risk for developing breast cancer, especially early in life. And this is passed along in families. So we see that the pattern is that there will be women with breast cancer in each generation. It can also be associated with ovarian cancer. And so that's why the family history component is so important, is because if we see or if you find that there's a pattern of breast cancer in every generation in your family, then you want to talk to your doctor and go and meet with a genetic counselor or somebody that specializes in taking care of women with these types of mutations to have the testing done. And if we identify that before breast cancer even develops, there are things that we can do to reduce the risk that can include surgery, closer surveillance with mammogram and MRI, or taking medications to help reduce the risk of breast cancer.
And does insurance cover that sort of screening or testing?
Yes, it does. So for patients that meet criteria for that testing, it is covered by their insurance.
Okay, and you mentioned one of the reasons why breast cancer rates have dropped is because of early detection. And you talked about having better imaging now available, better technology in order to identify breast cancer. Tell me about that new technology and how is AI, if at all, playing a role in that?
So, as far as the imaging is concerned, mammography now has 3D mammography or tomosynthesis. And so it's kind of like a CT scan of the breast of sorts, in that it takes multiple images of the breast and it turns it into a video. So it gives a more in depth view of the breast that allows the radiologist to see the breast a lot clearer and be able to see things a lot earlier than they had before. And sometimes it makes it easier to do that without having to have an ultrasound as well. Um, so that's really kind of some of the advances that we've made in mammography, which is the primary screening modality for breast cancer. AI has always been a part of looking at breast imaging, and because at breast imaging from a computer that's not as fancy as the radiologist, I don't use any AI in my practice. However, I know that there are some programs that do help the radiologist as well.
A lot of women have what's called and referred to as dense breasts. And it's my understanding, I'm one of them, that it makes it even more difficult to diagnose breast cancer. Explain to us what exactly that means and what should you do if you have been told that you have dense breast tissue?
That's a great question. This is a hot topic as well. So, your breasts are made up of three parts. There's mostly fat, lobules, and ducts. So, these are just little parts of the breast. And so, younger women have a lot more of the ducts and lobules. This is the parts that make milk when they have babies. And so, those parts of the breast make the breast very dense on imaging. It's a little bit more difficult to see through the breast with a mammogram. And as we get older, most women's breasts will turn more into fat. They'll be more see through, but some women do tend to have breasts that are dense throughout their aging. With that being said, to get away from all the technical parts of it, it is required by law for you to know what your breast density is when you get a mammogram. And so you should get a letter back from the facility that tells you what type of density your breasts are. If you have extremely dense or heterogeneously dense breasts, that'll be in the report, then it means that you should probably have some supplemental screening done along with your mammogram, like an ultrasound. So, an ultrasound can help us see through the density or the cloudiness of your breasts to help better detect masses that we may not be able to pick up on mammogram because of the density.
And it's important to note that you should get a mammogram every year, right? And but not everyone does that.
Yes, and so there are different guidelines that you may find regarding screening for breast cancer, but the major cancer societies and radiology, surgical societies do recommend that women get a mammogram starting at age 40 and have that done every year. And you should keep going as long as you're healthy enough to undergo the treatment related to a diagnosis of breast cancer, then you should continue to have screening for breast cancer.
You mentioned earlier that you think increased screening, increased awareness, early detection is perhaps one of the reasons why we are seeing more cases of breast cancer. Do you think there is anything else that could be contributing to a higher rate of breast cancer cases being diagnosed?
Yeah, I really wish we could pinpoint exactly what's causing that. Um, there are so many factors that go into what causes breast cancer to develop that it's hard to say that it's just one. I think as time goes on, we'll have a clearer picture of exactly why are we seeing more breast cancer, but right now we don't have that answer.
And it's also my understanding that breast cancer treatment has evolved dramatically over the past couple of decades. Tell me about some of the new technologies, the new breakthroughs in treatment that people who are diagnosed with breast cancer now undergo, where it's far different than what they might have been facing with even 10 years ago.
So one of the things that I feel has really changed a lot is the treatment for triple negative breast cancer. So that is one of the most aggressive subtypes of breast cancer that we see. And traditionally, we did not have any targeted treatments for those patients. Now there is medication that's available for patients called immunotherapy that works very well for patients with triple negative breast cancer. And we're seeing a lot better outcomes for patients that had a very aggressive disease now. And in the surgical world, we're able to do a little less surgery for certain patients that give them better quality of life while not decreasing their survival.
And of course, when we talk about breast cancer, we often think of women, but it affects men as well.
Absolutely. So it's not very common, but it does happen in men as well. So physical exam is really important, just knowing your body. If you feel something that's abnormal, you want to go and talk to your doctor so that you can get an ultrasound and a mammogram to look at that. Even though breast cancer is not very common in men, we are seeing the rates go up in men as well.
What sort of resources are out there for people who may struggle to find health care, access to health care, may not have the best insurance or any insurance, but need care?
Yeah, so October is a great month for that. There are a lot of opportunities for reduced rate mammograms and free mammograms during the month of October. The health department also has programs that are specific to women's health for breast cancer and cervical cancer screenings. And so that's another opportunity for being able to get screening done.
And so, if unless there's anything else you would like to add, I'll just ask you, tell me a date when we can finally eradicate breast cancer. When will it finally be gone?
I hope that date is closer than we know. I
Yeah.
just am really encouraged because I know that the treatments that we have now are so much better than they were 5, even 10 years ago. And
Hmm.
so, breast cancer is a very treatable and curable disease, especially when it's detected early. So, knowing your history, knowing your physical exam, your own body, and going and getting your screenings done are really going to continue to make death rates and go down for breast cancer.
Yeah, and just I know we talked about resources out there for people who may be struggling to find healthcare, but there are a lot of support groups out there too. If you are going through this or have a family member who's going through this, there's a lot of just emotional support available in our community.
Yes, absolutely. There are a lot of support groups here within Central Florida, uh, groups like Libby's Legacy, Sisters Network. There are a ton of support groups. We have a lot of support groups within our hospital system at Orlando Health Cancer Institute. We really are a community focused on making sure that women get through this difficult time and put it behind them.
Is there anything else you would like to mention as we kick off Breast Cancer Awareness Month?
Ah, use this as an opportunity to get your mammogram scheduled. It doesn't have to be within the month of October, but it's a good time to at least get that appointment on the books and then use it as an opportunity just to really get all of your health care in line. So, schedule that appointment with your primary care doctor and just making sure that you bring somebody with you when you go and get your mammogram.
Well, as you noted at the beginning of this interview, early detection is key and perhaps one of the biggest reasons why we are seeing those death rates drop. So, Dr. Danielle Henry with Orlando Health Cancer Institute, thank you so much for spending some time with us today.
Well, thank you so much for the opportunity. Have a great day.
Thank you, you too.